Good morning, everyone. For today's presentation, I, Frestiani R.S, and my friend Islamia Hartono Putri will discuss about the topic violence against children. During this presentation, we will discuss about the types of um, child abuse and also how to investigate it for criminal proceedings, such as the techniques that is used by psychologists to extract information from children regarding the abuse, etc. And lastly, we will discuss about a case study based about one of the types of child abuse that is mentioned in this presentation. And now let's begin. So first of all, I want to talk about the global prevalence of child abuse. According to a statistic by the WHO, globally it is found that up to 1 billion children aged 2 to 17 years old have experienced at least one type of child abuse in 2022. So there are four major types of child abuse or child maltreatment that is generally used as a classification. So there are physical abuse, sexual abuse, neglect, and emotional abuse. Now let's discuss one by one. So the first one is physical abuse. The definition of physical abuse is the deliberate application of force to any part of a child's body that results or may result in a non-accidental injury. So examples of physical abuse towards children can include punching, beating, kicking, biting, shaking, and other actions such as throwing, stabbing, choking, burning, or biting. And next, I want to discuss about several effects that the victim of physical abuse can get from the abuse. So the first set of impacts is short-term impacts. If we can imagine, physical abuse is harmful towards the children's physics. So there are several effects that is related to their physiological health, such as or physiological or cognitive health, such as greater perceptual motor deficits and lower measured intellectual functioning. As an example, lower measured intellectual functioning can be caused by head injury that is caused by the physical abuse. And these effects can also lead to other effects. For example, lower measured intellectual functioning can lead to lower academic achievement. Other than obtaining impacts through the physical harm caused by physical abuse, the impacts can also be caused by modeling behavior by the children. So the children who experience physical abuse might learn about the abusive behaviors from their perpetrator, and then they commit that behavior themselves. So an example of this impact is externalizing behaviors such as aggression. Physical abuse can also impact the victim psychologically, such as through internalizing mental health difficulties. For example, the victims might feel a sense of hopelessness and depression. Several research studies have also found behaviors that can be predicted from victims of physical abuse. One study found that physical abuse is related to heavy episodic drinking during adolescence and young adulthood. Another found that it is victims of physical abuse are predicted to experience social peer rejection, psychological distress, and engagement in non-familial violence, child abuse, dating violence, and spousal abuse. For the last point, it can be inferred that victims of physical abuse might be trapped in a cycle where they turn from being a victim into a perpetrator themselves. And we can also see here that the impacts covers not only physical impacts but also social and psychological impacts too. And then next is sexual abuse. So the definition of sexual abuse is the use of child for sexual purposes. Examples of sexual abuse include fondling, intercourse, incest, sodomy, exhibitionism, or exploitation through the use of children for pornography. And just like physical abuse, sexual abuse also have short-term and long-term impact. So for the short-term impact, sexual abuse can result in the acquirement of behavioral problems on the victims, lowered self-esteem, inappropriate sexuality that is not aligned with the norms according to their age, and then symptoms of PTSD, because sexual abuse is, of course, a traumatic experience. That's why it can uh, cause PTSD on the victims. And lastly, the victims might also experience physical difficulties, such as sleep disturbances, eating disorders, stomach problems, and headaches. And then next, sexual abuse can also cause long-term effects. So, studies found the correlation between sexual abuse with several psychiatric disorders, such as major depression, self injurious behavior, including self harm, and then anxiety, as well as interpersonal distress. It is also related to dysfunctional behaviors, such as sexualized behaviors. And this is due to the early exposure to sexuality, which is inappropriate for the children of their age. And then the next is neurobiological dysfunctions, including reduced hippocampal volume. And the next one is increased risk of sexual victimization, also increased risks of alcohol problems, illicit drug use, and family problems. And then the next one is neglect or failure to provide. So, neglect is defined as failure to provide for a child's basic emotional, psychological, or physical developmental needs. And examples of neglect can be failure to provide appropriate supervision, and failure to provide food or nutrition, safe shelter, safe environment, medical care, and so on. And then the last major types classification of child abuse is emotional abuse, which is referred to as the acts or omissions by caregivers that cause or could cause serious behavioral, cognitive, emotional, or mental disorders. So if we see here, in the first three sentences, it says acts or omissions. So it can be the act of adults that causes harm, or the lack of acts or omissions of acts that causes harm to the children's developmental process. So example of emotional abuse include verbal threats, social isolation, intimidation, exploitation, terrorizing, constant criticism or rejection. And now I want to talk about the risk factors for abuse. So here I have provided a set of risk factors for two types of abuse, which are physical abuse and sexual abuse. So about the characteristics of the child or the victim. For physical abuse, male children are more likely to be a victim of physical abuse, whereas for sexual abuse, female victim instead is more likely to be a victim. And then for the parental factors, so the parent of the victim, for physical abuse, the parents are usually have a young maternal age, so they become a mother in a young age, or they have single parent status, or they have a history of childhood physical abuse and spousal assault, or they have unplanned pregnancy or negative attitude towards pregnancy, or they have history of substance abuse, and lastly, they might have social isolation or lack of social support. On the other hand, for sexual abuse, the parents of the victims, which could be the perpetrators too, have the characteristic are commonly have the characteristic of living in a family without a biological parent, have poor relationship between parents, and presence. There is a presence of a stepfather, and there is a poor child-parent relations. And then lastly, for the social factors, for physical abuse, the victims usually belong to low socioeconomic status and has a large family size. So if the children have these risk factors, then they will be more likely to be the victim of the abuse. And then next, I want to discuss other forms of child abuse outside of the four major ones. So the first one is infanticide, neonaticide, or filicide. So actually, infanticide is the umbrella term for neonaticide or filicide. So infanticide is the killing of children up to 2 years of age. And meanwhile, neonaticide and filicide is included in the category of infanticide, and neonaticide refers to the killing of an infant within 24 hours of being born, while filicide is the killing of an infant older than 24 hours. However, in the criminal proceedings, usually the term infanticide is more often used. And now I want to talk about the risk factors or victim and perpetrator characteristics that can predict infanticide. So usually the victims of infanticide are male infants, while the perpetrators are often the victim's parents, or if it's a non-parental figure, male individuals are more likely to commit infanticide. And the most common case for infanticide is committed by women who hide their pregnancy. So this is usually in the terms of neonaticide, and this is done usually like a short time after the birth of the children, because the woman wants to hide their pregnancy due to shame or opposition from family. And although this is rare, a lot of case of infanticide is committed by women suffering from mental problems, and this could be in the form of postpartum psychosis or PTSD. So actually, there are different types of postpartum. So there is postpartum blues, which is the least severe of postpartum, and it usually happens only within few days after the birth. And then there is postpartum depression, which we probably are more familiar with. And this is if the symptoms of postpartum blues still happens after a long time has passed. And then lastly, the most severe one is postpartum psychosis, which happens when the symptoms of postpartum is accompanied by psychotic episodes. So, in the case of women suffering from mental problems, the infanticide can be committed through directly murdering the victim or acts of omission. So, acts of omission can be refusing to tend to the baby, refusing to give food, to attend for their needs, etc. And that will eventually cause the death of the baby. And then next is Munchausen syndrome by proxy, or commonly referred in the medical world as medical child abuse. However, for us as psychology students, in the DSM-5, it is referred to as factitious disorder committed in another. So, Munchausen syndrome by proxy is happens when a parent consistently or chronically subjects a child to medical attention without any true medical condition or symptoms being present. So how they do this, how they convince other people or the child themselves that they have medical issues is that they can do it by making up false diagnosis, or they could do it by actually harming the children through symptom inducement. So, symptom inducement can include adding fat to stools in order to produce a laboratory abnormality, initiating starvation in the child, placing blood into the child's urine sample before lab testing, or injecting contaminating or toxic material intravenously into the child's bloodstream. So, if you see here, in the right side there is a picture of a mother and her daughter, and we will discuss their case for the case study. So here are the victim and perpetrator characteristics of Munchausen syndrome by proxy. So the victims are often young child, ranging from the age of 6 months to 8 years. And both male and female victims are equally represented in the victim of Munchausen syndrome by proxy. And the victims also come from all socioeconomic background. And usually the victim has emotionally distant or physically absent father, especially if the perpetrator is the mother. Meanwhile, for the perpetrator, it is commonly committed by mothers, and they tend to be over-involved, emotionally empty, lonely mothers, or a mother with history of significant physical, emotional, or sexual abuse during their childhood or young adulthood. And these mothers are usually perceived to be an ideal, devoted, doting, loving mother by the public because of their dedication to care for their ill children. And they are usually sophisticated with medical conditions or have experience working as a medical professional, or at least has some kind of knowledge about the medical field. And they're usually unusually attentive, and they tend to refuse to leave the child during medical procedures. And then the next one is abusive head trauma, or commonly known as shaken baby syndrome. So, shaken baby syndrome happens when the adult shakes the baby too hard, and it causes injury to the baby. So we know that baby, as baby are still young, Their brain, neck muscle, and blood vessels are still very fragile. So when they are shaken hard, their neck has inability to control the head movement. So that's why the brain might hit the skull wall, and this might cause the blood vessels to burst. And this can cause brain damage as a result, which can result in intellectual disability, speech and learning disabilities, blindness, paralysis, seizures, hearing loss, or even death. And adults shaking babies too hard is usually caused by their frustration because the baby cries a lot or the baby has problems eating or toilet problems. And now for the victim and perpetrator characteristics of abusive head trauma. So the victims tend to comes from both genders, male and female, and also is represented in all socioeconomic background. Meanwhile, the perpetrators are usually male in their early 20s and commonly a parental figure, and they are usually ignorant about the danger of shaking a baby. That's why after birth in a hospital, usually the parents will have to undergo psychoeducation about the danger of shaking a baby before they're allowed to bring the baby home. And the perpetrators also tend to have poor child rearing skills. Next is the last one is child abduction. So it is defined as unlawfully leads, takes, entices, or detains a child under a specified age with the intent to keep or conceal the child from his or her parent, guardian, or other person having lawful custody. So usually child abduction is classified into two, which is family abduction and acquaintance or stranger abduction. So for family abduction, the victims are represented in both genders, and the perpetrators are usually the parents, and both male and female perpetrators are equal in the number. And then now is the psychological impact of family abduction. So family abduction is traumatic for the victim and the family left behind, and usually the impact on the victim is determined by whether or not force is used in the accident incident of abduction, and whether the child is concealed from the public, because usually the perpetrator want to conceal the child because they fear that they might get caught and the child will be taken from them. And lastly, whether the duration is long, because the longer the duration is, the longer the psychological impact, or the harsher the psychological impact will be felt by the victim. And meanwhile, for the effects on parents, the parents that is left behind by the children might feel feelings of loss, rage, impaired sleep, loneliness, fear, and severe depression. So usually in the case of family abduction, it is committed by the parents who doesn't have the legal custody rights for the children. That's why they use unlawful means to take the children from the legal parents. Meanwhile, for the acquaintance and stranger abduction, it usually happens in a public outdoor location or in the victim's own residence. And it is usually motivated by sexual interest. And in cases of murder, the first 3 and 24 hours are crucial because in the first 3 hours, 70% of victims are murdered within this time range. And that's why these 2 hour window is crucial in finding the victim of kidnapping. And then it less likely occurs than family abduction. And specifically for acquaintance abduction, the perpetrators are usually categorized into three. The first one is lovers or ex-lovers. So the motivation of this type of perpetrator is usually a revenge, because maybe they break up due to dispute or conflict, and the perpetrator wants to take revenge on the victim. Or it could be in an attempt to persuade the victim to reconcile with the perpetrator. Or it could be due to the desire to commit sexual assault towards the victim, or to avoid forced separation by parents, especially if the parents doesn't give permission for the two to be in a relationship together. And then the next category is abduction by gang members. So usually gang members will abduct other people because they want to intimidate them, or as an act of retaliation against the victim, or because they want to actually recruit the victim into the gang. And lastly is abduction by family members or employees, which can include nannies or caregiver of the victim. So the motivation is usually sexual assault or retaliation against the family of the victim. As for the stranger abduction, the perpetrators are usually unknown to the victim, so the victim usually doesn't know who the perpetrator is, but the perpetrator might know the victim, maybe through other people or through stalking the victim.
Now, we're going to discuss about how to investigate violence against children. First, we're going to talk about repressed memories and recovered memories. So, repression refers to the psychological process of keeping something out of awareness because of unpleasant effect connected with it, with the memories. The something may be a memory or part of a memory, a fantasy, a thought, an idea, feeling, a wish, an impulse, a connection, and so forth. Repression may include loss of memory of the trauma, for example, amnesia, and in some individuals, and partial fragmentary memory in others. There are side of psychologists that believe that with skillful therapy, these repressed memories can be fully and accurately recovered when the person feels it is psychologically safe to do so. While there are the other side of psychologists that believe that the existence of repressed memories is highly unlikely and questionable. This side argues that recovered memories of abuse are largely false memories that sometimes can be inadvertently developed by therapists. Next, special experts panels on repressed memories. The American Psychological Association, or APA, Working Group on Investigation of Memories on Childhood Abuse. The panel of clinicians and researchers was able to come to the following five conclusions. First, controversies regarding adult recollections should not be allowed to obscure the fact that child sexual abuse is a complex and pervasive problem in America that has historically gone unacknowledged. Second, most people who were sexually abused as children remember all or part of what happened to them. It is possible for memories of abuse that have been forgotten for a long time to be remembered, and it is also possible to construct convincing pseudo-memories for events that never occurred, and there are gaps in our knowledge about the processes that lead to accurate and inaccurate recollections of childhood abuse. Next is the sketches of human memory and limitation. So, there are important points about memory made by three of the leading scientists in the area, including not everything gets into memory. What gets into memory may vary in strength. The status of information in memory changes across time, and retrieval is not perfect. The limitation of sketches of human memory in children. In young children, memory traces are often not as strong because children generally lack the requisite knowledge and experience to fully appreciate the event. Thus, they may undergo more rapid decay than the memory traces of older children. Young children, such as preschoolers, are usually more susceptible to the influences of misleading information received after the event that are older children and adults than are older children and adults. And now, how do children recall memories in the case of children abuse or violence? The first one we're going to discuss about the recall for events. One of the way to recall for events is free recall versus directed questioning. So when children are asked to report all they can remember using a free narrative approach, their accuracy in reporting is comparable with adults. But unfortunately, children tend to report very little information using a free narrative. Therefore, direct questions or probes, such as "What else do you remember?" or "Tell me more about what you remember," are often necessary to elicit the required information. Other than free recall versus directed question, there is anatomically detailed dolls. It is a doll, sometimes like a rag doll, that is consistent with the male or female anatomy. The assumption underlying the use of these dolls is that the children may have difficulty verbalizing what occurred, and by playing with the dolls, by playing or telling the story with the dolls, they will demonstrate the events they experience. There are also other techniques for interviewing children in order to recall for events, including first, human figures drawing. So the use of human figure drawing or HFDs when interviewing young children is popular. It is believed that children are able to understand the representational nature of a two-dimensional drawing at a younger age than the symbolic meaning of three-dimensional models such as anatomical dolls. And there is criterion-based content analysis. It is an analysis that uses criteria to distinguish truthful from false statements made by children. And criterion-based content analysis is part of a statement validity analysis. It is a comprehensive protocol to distinguish truthful or false statements made by children, containing three parts. The first one is a structured interview of the child witness. The second one is a systematic analysis of the verbal content of the child's statements. And the third one is the application of the statement validity checklist. And there's also stepwise interview. It is an interview protocol with a series of steps designed to start the interview with the least leading and directive type of questioning and then proceed to more specific forms of questioning as necessary. Lastly, in the United States, there are psychologists that develop an interview procedure called narrative elaboration. With this procedure, children learn to organize stories into relevant categories based on participants, settings, actions, conversations, or affective states, and the consequence. There is also a National Institute of Child Health and Human Development interview protocol. Dr. Michael Lamb and his colleagues at the National Institute of Child Health and Human Development developed an interviewing procedure that relies on open-ended questioning with two types of prompts available to interviewers. Interviewers can use time prompts to have the child fill in details and a timeline. Also, interviewers can use Q questions prompts where details that the child has reported are used in the question and children are asked to elaborate. Other than recall for events, there is also recall memories following long day. So Lindsay and Reed 19 1995 suggested five criteria to consider when determining the veracity of recovered memory. The first one is age of complaint at the time of the alleged abuse. It is unlikely that anyone would have a memory of abuse or otherwise prior to age 2. And the second one is techniques used to recover memory. Techniques such as hypnosis and guided imagery heighten suggestibility and encourage fantasy. Third, a similarity of reports across interview sessions. Do the reports become increasingly more fantastic or are they similar? Fourth is motivation for recall. Is the client experiencing other psychological distress and wanting an answer to explain such feelings? And lastly, time elapsed since the alleged abuse. It may be more difficult to recall abuse that occurred 25 years ago than abuse that took place 2 years ago. And lastly, there is recall for people. A recall for people involves recognition from a lineup. And based on this notion, Pozzolo and Lindsay in 1999 developed an identification procedure for children known as elimination lineup that is consistent with the two-judgment theory of identification accuracy. The elimination lineup procedure requests two judgments from the child. First is all lineup photos are presented to the child, and the child is asked to select the lineup member who looks more like the culprit or the relative judgment. Once this decision is made, the remaining photos are removed. The second, the child is asked to compare his or her memory of the culprit with the most similar photo selected in the first stage and to decide if the photo is of the culprit or absolute judgment. Last, we're going to discuss about roles of the forensic psychologist in child abuse cases. Forensic psychologists are all too familiar with the results of violent victimization. When the perpetrator of the violence is a family member or an intimate partner, the effects are particularly devastating. Psychologists evaluate victims of violent crime to assess the extent of their psychological injury. Results of those evaluations may then be used in civil or criminal proceedings. Psychologists also may evaluate or offer treatment to violent offenders.
And now, finally, I want to discuss about the case study that I have mentioned earlier, which is a case study of Munchausen syndrome by proxy. So this case study is about a Gypsy Rose Blanchard and her mother, Dee Dee Blanchard. So in 2015, Gypsy Rose Blanchard was a 23-year-old woman living with her mother, Dee Dee Blanchard. She was born to a separated parents in 1991. And starting from the age of 3 months, her mother started to believe that Gypsy had several health issues, beginning from sleep apnea, muscle dystrophy, leukemia, etc. And Gypsy was believed to have the mental age of a 7 or 8-year-old girl, and her mobility was limited due to her physical conditions. That's why she usually used wheelchair to move around. And as such, her mother became her primary caregiver, and Gypsy stopped attending school at grade 2 of elementary school. So the two of them lived off of Gypsy's child support provided by her father and the public donations because Gypsy's story was popular among the public and gained enormous sympathy from the public. And Dee Dee, her mother, was admired for her dedication to caring for her ill daughter. So Dee Dee was always insistent on being present for her daughter's doctor's appointment. She was very open about her daughter's medical condition and would tell about Gypsy stories to the people she knew, be it family or stranger. So on the 14th of June 2015, uh, Dee Dee's severely wounded body was found lying in a pool of blood in her own bedroom. Upon autopsy, it was found that she had been injured a few days before being found. Gypsy was nowhere to be found. The public initially believed that Gypsy was kidnapped after Didi's murder. However, after some time, Gypsy was actually found with her intern boyfriend in Wisconsin. And it was then revealed that none of the medical condition Gypsy supposedly had, as claimed by Didi, ever existed. In reality, Gypsy had been lied to and forced by her own mother to believe that she was ill throughout her life. And after realizing her mother's lies, having had enough as a retaliation and attempt to achieve freedom from her mother, Gypsy planned her mother's murder with her boyfriend, and then, after committing the act, they ran away together. So, although there is two crimes here, which is the Munchausen by syndrome by proxy committed by Didi, and then Didi's murder committed by Gypsy and her boyfriend, I want to focus on the violence against children and discuss about the Munchausen syndrome by proxy committed by Didi Blanchard. So let's analyze Didi Blanchard as the perpetrator of Munchausen syndrome by proxy. So the identity of the perpetrator is Didi Blanchard, that has birth name Claudine Putri, and she was 48 years old at the time of her death, and she is divorced from her husband Rod Blanchard, and she was the mother of the victim, which is Gypsy Rose Blanchard. So here's the family history of Didi. Her parents are named Claude Anthony Pitre Sr. and Emma Louise Gisclair. And Didi is one of five siblings. Didi's educational history is unspecified in the case description, and she only has one employment history, which is in her adulthood she served as a nurse's aide, and after that she is unemployed and is mainly being the primary caregiver of Gypsy Blanchard. And Didi has one marital history, which at 24 years old, she married Rod Blanchard, which was 17 years old at the time. And then prior to Gypsy's birth, she was separated from her husband, and then later they got divorced. And for the medical history, it is also unspecified. For psychological history, there is not much diagnosis, but Didi has showcased several suspicious behaviors throughout her life, such as regularly stealing from family members, which they suspect was an act of retaliation. And then she is also suspected of committing deceptive behavior about Gypsy's medical condition by Gypsy's doctors. And the environment and sociocultural condition is also unspecified in the case description. And as for a social interaction history, she had some conflict with the family due to suspicion of stealing, and also the family also suspect her of killing her own mother. However, they remain supportive of each other. For example, after Didi's divorce, she moved back to live with her family. And she also maintained a co-parenting relationship with Rod Blanchard, which is Gypsy's father. And she often interacts with the public related to Gypsy's illness. And she is favored by the public, and she received a lot of public support in terms of just encouragement, emotional encouragement, or financial support. So for the initial assessment, Didi Blanchard, we suspect that Didi Blanchard had a factitious disorder imposed on another, or here we refer to as Munchausen syndrome by proxy. So according to DSM-5, the symptoms of this disorder include falsification of physical or psychological signs or symptoms, or induction of injury or disease in another associated with identified deception, which she showcased and is described in the case description. And then the individual presents another individual or victim to others as ill, impaired, or injured, in which case she presents Gypsy Blanchard towards other people, such as her family, her ex-husband, or the public, as being ill. And then there are two symptoms that uh, we are unable to determine whether Didi Blanchard has this. So the first one is the deceptive behavior is evident even in the absence of obvious external rewards. And then the last one is the behavior is not better explained by another mental disorder, such as delusional disorder or another psychotic disorder. So, because we cannot confirm these two symptoms based on the case description, further assessment is needed to confirm this hypothesis. And so, the victim. Oh, here is the victim and perpetrator characteristics in line with Munchausen syndrome by proxy that we found in Gypsy Blanchard's case. So the victim is a young children and has physically absent father. So as we remember, Didi started to uh, believe that Gypsy has medical issues from a young age, which is when she was only 3 months old. And this is actually younger than the normal age range of 6 months to 8 years old. And then, due to her parents' divorce, Gypsy also has physically absent father. So although her father visits her a lot, he is not the primary. He doesn't have the primary custodial rights. And as for the perpetrator, which is Didi Blanchard, she was described as an over-involved mother, and to the public, she appeared as an ideal, devoted, loving mother, and she was actually admired by a lot of people. And Didi is actually familiar or has some knowledge about medical procedures. If we remember, in her employment history, she once worked as a nurse's aide, which means that she has experience working in the medical industry. And then lastly, she shows reluctance to be separated from Gypsy during her medical examination. And that's it for our presentation. Thank you for listening.